Well, if you or someone you know has been prescribed amlodipine, you are in the right spot. In this video, quickly we shall run through this very commonly used medicine, that is amlodipine. Make sure you watch this till the end so that you get complete information about this. First of all, what is amlodipine? What category of medicine it is? So it's called as calcium channel blocker. Now let's look at this in detail. For every muscle to contract, calcium has to get into that muscle. So it also includes the muscle which is there in the blood vessels of your body. So if the muscle in the blood vessel contracts, what happens? The blood vessel becomes narrow. So now imagine a narrow blood vessel and a dilated blood vessel. Let's understand this with some simple example. Imagine you need to send certain amount of water, one through a very small pipe, another through a very large pipe. Where is it easier? Of course, it's easier with a larger pipe, right? But if you still have to send same amount of water through the narrowed pipe, what can you do? Maybe you need to use some force, maybe connect it to some pump so that it goes through that narrow space, right? So this is exactly what happens in the body. If the blood vessel becomes narrow, heart has to strain more, it has to put more effort so that the blood passes through these narrow vessels. Whereas if the blood vessel is dilated, it becomes sort of easier for the heart. Again, I am not generalizing this statement because there are always exceptions and there is always a limit up to which this happens. But roughly speaking, if the blood vessels are dilated, the blood pressure drops and it becomes easier for the heart to do its work. So as I told previously, when the calcium ion enters into the muscles of the blood vessel, it contracts. So if you somehow prevent these calcium ions from getting into these muscles, then you will be able to achieve your goal of not letting it contract, right? Yes, this is what is done by the medicine amlodipine. So it is basically a calcium channel blocker. So it prevents the calcium entry into the smooth muscles and hence the blood vessel is dilated because of this medicine. This is how it works. So where is it used? Quite obvious, it is used to lower the blood pressure in case of hypertension, whether in adults or children. It's also used in certain forms of angina, that is chest pain. The mechanism being, I told you previously, it sort of makes the work of the heart to some extent easier. So if your blood pressure is high, should you be directly going to the pharmacist and taking amlodipine? Absolutely not. Because there are a lot of things which need to be taken into consideration, which your expert, that is your doctor, will do. And then if he or she feels that amlodipine is the suitable medication for you, then it will be prescribed to you. Of course, other things will be seen, that is, if there are any contraindications for giving this medication. For example, liver dysfunction or some sorts of heart failure, aortic stenosis, or say if you're pregnant or planning to get pregnant, then too there should be a word of caution in using amlodipine. Is there any medicine which comes with absolutely no side effect? Well, if there is effect, there has to be side effect as well. So what matters is how severe is it. Fortunately enough, amlodipine doesn't really come with a lot of severe side effects. The common ones being some amount of swelling in the ankle and leg. You might have noticed it in a lot of patients who have started with this drug, that their foot and leg starts sort of swelling. It's a benign thing and usually settles down over time. They may feel slightly dizzy, or there can be hot flushes in the face. Now these are all the results of vasodilatation or dilatation of the blood vessel. But if there are severe symptoms in the form of rapid increase in the heart rate, palpitations, severe dizziness, then of course you need to consult your doctor, and doctor will probably make alterations in your hypertension medication. Let me give you some tips if you're taking amlodipine. Of course, how many times to take, it will be told to you by the doctor. But generally, amlodipine is given once a day. make sure that you take this medicine almost at the same time every day, so that there is constant amount of its dosage in the blood. Don't do it like one day you take it at 8 o'clock, next day you're taking it at 11 o'clock, another day you're taking it at 6 o'clock. No, don't do that. Stick to a particular time and try to take it at that time, with or without food. It doesn't really matter much if you have had food or if you didn't have food. So it is okay. Try to stick to a particular time. If you have been taking amlodipine for quite some time, a very important thing is that try not to miss the dose or stop it abruptly, because your BP can shoot up if you stop the medicine abruptly. So don't stop it abruptly. Probably the most important point of this video is that if you have been prescribed amlodipine to lower your blood pressure, you need to understand that it is only one part of your blood pressure management. What I mean to say is, if your doctor has asked you to take, please do take it, but at the same time give equal importance to all the other aspects of blood pressure management. Do a regular physical exercise, take a balanced good nutrition, lower your salt intake, avoid smoking, and avoid excess of alcohol. If you do all these things along with taking right amount of amlodipine at the right time, I am sure your BP will be under control. And also make sure that you check your blood pressure regularly, so that you know very well if all these things in addition to amlodipine is working, or you need to probably add another medication for the same. So I hope you found this short video about amlodipine useful and informative. If so, make sure you get a thumbs up, share it with those who may be taking amlodipine, and do consider subscribing to this channel for more informative videos.